So how does neglect occur in an assisted living facility when the care that's required in an assisted living facility isn't as great as the care required in a skilled nursing facility? There's a couple answers to that question. Number one, the first thing I do is to make sure the person was appropriate for the assisted living facility. A lot of times assisted living facilities will take in residents who they're really not capable of taking care of. So they want to fill the beds because they want to make the money, but the person may need more care than that assisted living is really able to give. So I'll look at the assessment that was done prior to them going to the assisted living facility, and then I'll look at the signs and symptoms and conditions that person expressed while they were at the assisted living facility. For example, an assisted living facility is not supposed to take care of a resident with a stage 3 or stage 4 bedsore. That person needs to be moved out of the assisted living facility. But if the assisted living facility maintains that person in the facility just because they want to keep the bed filled and make the money, then that's a problem. The other things we look for in assisted living facilities are maybe they have a locked unit because they're taking care of dementia residents. And dementia residents or Alzheimer's residents, they can often be physically capable of meeting a lot of their own needs. They can dress themselves, feed themselves, things like that, but they need constant reminders. And a lot of times they don't know where they are. So in an assisted living facility that's supposed to have a locked unit, the calls that I will get are patients who have eloped or walked out of the facility and been injured on the street, walking down the street, falling down into a ditch, being hit by a car. So elopement cases, or cases where people with dementia have wandered out of the facility and gotten an injury out of the facility, those are the types of assisted living facility cases that we see and where we see neglect.